depending upon the time. Now this bleed can be divided into hyperacute, which is less than 24 hours, and it will appear hypo or iso-intense on T1. Here you can see this is iso-intense on T1, and it is bright hyper-intense on T2. The acute phase, it lasts for 1 to 3 days, and it is going to be again iso-intense on T1. On T2, it will get darker now. It is hypointense. It appears hypointense on T2. Then in the early subacute phase, the subacute phase basically starts from the second day till the 28th day, or second till the fourth week. It can again be divided into early subacute phase, 3 to 7 days. Now the bleed on the T1 gets brighter. It appears hyperintense, but on T2 it is hypointense. Whereas in the late subacute phase, 7 to 28 days, this bleed is hyperintense on T1, but on T2 now it gets brighter. In the chronic stage, that is after 1 month, any bleed would appear hypointense on T1, hypointense on T2, with a slight hyperintensity in the center. Let's make it a bit more easier. So now what we can do, that the acute phase which lasts for 1 to 3 days, now 1 to 3 days, it remains iso to hypointense on T1, that is same, but initially for 1 day till 12 hours, it will remain hyperintense, that is bright on T2, but eventually it will get darker. When we talk about the subacute phase, which lasts for starting from the third day till 28th day or the fourth week, the bleed will appear hyper intense on T1 in both the phases, early and late. Early remains for 7 days, and from 8th day till 28th day, that is the late subacute uh, late subacute phase, the bleed will get brighter on T2. Whereas in the chronic phase, which is from 1 month onwards, the bleed will get dark on both. Let's now practice here. If someone can volunteer and they can tell uh, in picture A what is happening, what kind of bleed is this? So as it is dark or iso-intense, can everybody hear me?
ये जो है उसमें ये सर सब एक्यूट हाइपर एक्यूट है.
Okay, so you need to see both the cuts, in the cut A and in the cut B. It appears dark in the hypo intense on T1, but it appears hyper intense on T2.
So it's hyper acute less than
Yes,
24.
exactly. This is a hyper acute, in which it is iso intense, hypo intense on T1, and it is appearing brighter on T2. Okay, so what is C?
So in T1 it is hypointense, and T2 is also hypointense. ये भी डाल के, तो ये acute stage है ये.
हाँ जी, बिल्कुल, ये acute phase में हम आ गए हैं. It is 1 to 3 days in which it is appearing hypointense on T1, but it is getting brighter now on on T2. So it is the acute form from 1 to 3 days. What about E?
So next one is bright on T1 and dark on T2. So it's early subacute stage.
Yes, now it is in the subacute phase. Whenever the bleed gets brighter, now we are into the subacute phase. On T1, it is hyper intense, whereas hypo intense on T2 images. It lasts from third day till the seventh day. Now in these pictures, it appeared bright both on T1 as well as on
Okay.
T2. This is the late subacute phase in which the bleed will get hyperintense on both. Whereas in the last two pictures, we can see the bleed appears dark both on the T1 as well as on T2. So this is chronic phase. The bleed has lasted more than 28 days.
क्रॉनिक में जो T2 इमेज है उसमें ब्राइट नहीं होगा?
Sorry?
क्रॉनिक में क्रॉनिक
हाँ जी.
स्टेज में T2 इमेज में ब्राइट नहीं होगा? क्या मिक्स
नहीं,
पिक्चर
it
होगी?
will appear dark on both. Whereas in T2, the central portion can be a bit hyper intense, but usually it appears hypo intense.
हो गया, ठीक है सर।
Okay, after a stroke, let's move on to certain conditions in which contrast enhancing lesions we'll find. So this is a mnemonic for the ring enhancing lesions on MRI. This magical DR. So METs, abscess, granuloma, glioblastoma, infarct, contusions, age-related, specifically the toxoplasmosis, lymphomas, demyelination, as in the case of multiple sclerosis, and radiation necrosis. So this is a mnemonic for general remembering the different conditions, which will give you the appearance of ring enhancing lesions, but we'll focus on most common ones. So first of all, let's see, this is an high-grade glioma. Dr. Majabin will talk in detail about the tumors, but let's see certain important specific things which makes us makes it easier for us to diagnose how is it the high grade glioma. First of all, let's see. So here we can see this is basically a lesion which is hypo intense and it has a ring enhancement surrounding area. In addition to that, another important thing that we can see here, all this hypointensity. This is not basically a lesion itself, but this is the surrounding edema, periregional surrounding edema. Another important thing that we can see here that it is also causing the midline shift, so the pressure effect. Whenever you see a lesion with ring enhancement, and with the edema that is out of proportion, so it specifies this lesion is some sort of high grade tumor, probably METs. So this is a differentiating point. Let's move towards the brain abscess that we discussed yesterday in the CT scan. Now on the MRI T1 images, we can see a lesion which is hypo-intense in the center, and it is giving a thin rim of contrast enhancement. So this is brain abscess. Usually there is some periregional edema as well. It is shown here, but this is not as out of proportion as in the case of a high-grade glioma. Moving towards the brain contusion. Now, the brain contusion will also give, say, a similar picture, contrast enhancement. But here you can see there would be a husky or mixed kind of a lesion inside, which is not completely dark, hypointense, as in the case of abscess or in the high-grade glioma. The second differentiating point is usually the contusion is in close relationship with the bone. That is, it specifies that this is due to the post-traumatic contusion. Again, these are the pictures which are showing multiple ring enhancing lesions. Coming to the picture number 2, whenever there are multiple small lesions that are enhancing, that could lead to the diagnosis of the toxoplasmosis, whereas when you compare it with the picture number E, very deep-seated, minute, small, these can be large. These are slightly larger one as we compare with the toxoplasmosis, and these are in the central situated areas, periventricular, in the basal ganglia. These are usually lymphomas. Again, you need to correlate it with the history. This is a glioblastoma, and here you can see when you compare the mets, this is a very small lesion with out of proportion edema surrounding it, so the diagnosis will go towards the metastasis.